Symptomatic FAI is one of the most common things that I see in the clinic with the runners that I deal with. So this is going to be the start of a three-part video series where we go through managing the runner with a painful hip from the start of care all the way back to returning to consistent training. A lot of the stuff that we'll talk about is adapted from the Warwick Agreement. And we're going to be going over everything from initial education to progressing loading drills to the hip, and finally working on gait mechanics and higher level plyometrics. Hopefully this will help out some of you that are dealing with patients that have this, or if you're dealing with this as a runner yourself. Please post any questions or comments that you got, and I look forward to sharing with you. So the first thing we have to establish is that structural differences in the hip are absolutely normal. We have tons of studies that have looked at the structure of different hips and how simply having a different shaped femoral head or acetabulum doesn't mean that you're going to have pain or dysfunction. When we have somebody with an irritable hip, though, we do need to talk to them about avoiding impingement type positions for just a little bit to let the hip calm down. Now, for a lot of people, that tends to be things like going up steps with the affected leg. That can also be low squatting, whether in their workouts or in their day-to-day activities, and low sitting. Now, these things aren't bad long term, it's just that for a little bit they need to give it a little bit of a break to let the hip calm down. And the other thing that I'll see is a lot of aggressive stretching. So whether this is themselves or having a therapist or a chiropractor do aggressive manual on them, we need to let the hip calm down. And this is not a range of motion issue. They don't need more range. The range of motion required for running is really very minimal. What they need to do is let the thing calm down. Now, if they find relief from stretching, they can do it, but most of the time, it's not necessarily needed. Lastly, we want to work on progressively loading them. We're going to start in activities that don't require the hip to be in a grumpy position. So, basic drills, bilateral bridges. Again, we're not moving through a huge range of motion through the hip joint. Shouldn't be painful. Quadruped hip extensions, getting a little bit more hip flexion at the bottom, but again, should be something that shouldn't be painful or provocative. We need to get them to load the area that's giving them trouble. And finally, sideline hip abduction. By working on these three drills, we hit 3 different planes of motion, all of which are important to running, and can really help serve a base for what we're going to do moving forward.